My name is Brooke Jones. I am 34 years old and I have been clean since December 18th of 2018, and I owe it, all to the MAP program. And if I could explain the MAP program in one word, it would be hope. Hope for me stands for hold on, pain ends.
So MAT stands for Medication Assisted Treatment. So what that means is we have a treatment program for patients who suffer from opioid use or alcohol use disorder. So we use FDA-approved medications to treat those disorders in conjunction with behavioral therapy and medically monitored therapy. So we're able to use telehealth in our MAT program in certain instances when transportation is an issue for a patient, or in instances where there's no provider on site at that location, but a patient can come into one of our locations and then be set up for telehealth to see a provider at another location. Not all of our providers treat patients in the MAT program. It is a little bit of a specialized practice area. So not every one of our offices has a provider, but a patient could come to any one of our offices and connect to a provider who provides that service.
Counseling and behavioral therapies works in combination with medication-assisted treatment because it's evidence-based treatment that statistically, if a patient receives 6 months of treatment along with behavioral counseling, they're more likely to stay within the program and the retention rates are higher. So with behavioral therapies, we work with the patient when it comes to depression, when it comes to anxiety, when it comes to triggers for the addiction. We work with them on motivation to continue in the program. We work with the families if it is a family issue that has triggered the addiction. And we also work with patients who have past trauma that contributed to addiction.
So my life before the MAP program was horrible. I was in and out of jail. I was in and out of different rehabs. I've been to rehab like 8 times. I've been to jail 10 times. And I was not myself. I've been raised really, really good. I've got great parents. Never been exposed to the lifestyle I was living, and it took me down. I was in addiction for probably off and on. The longest I ever stayed sober was 6 months, and that was come from jail. I was in jail for 90 days and stayed clean for like 3 months after, and then I lost it all again.
What's rewarding about treating MAT patients is that I try to let them know this is not the end. They have the ability to go through full recovery, to have like a normal sense of life. They don't have to worry about financially being able to take care of their families. They don't have to worry about whatever that addiction was, putting more negative stimulus on their health. They have the ability to recover from it and have a brighter future.
Have hope. Hold on, pain ends, I promise. Sorry. You gotta want it. You gotta want it. I'm sorry. You gotta want it. And if you don't have a support system, lean on CareSouth. Because I didn't have a support system. Sorry, y'all. It's, I've overdosed and I'm not supposed to be here, and the good Lord has a different plan. So I am supposed to be here, So if I can do it, anybody can. This disease is nasty and it's evil. And it can affect anybody. People don't think it can hit your house, but it can. It can hit your family. There's no discrimination. I don't really know the word, but I know that there's nothing that would make me go back to that life. Everything that I got a car, I got my license back. because that's another thing. I lost my license in addiction. Now I've carried my whole family on vacation and paid for it, and never thought in a million years I'd be able to do that, you know. They've always looked out for me, you know. So have hope. Hold on. Pain ends, I promise.